Hi, students. This is another weekly wrap up. I can't believe it. It's the end of week 5, and you all got through test 1. We'll be reviewing it in class next week. I'll definitely be back next week, so I'm looking forward to that. For this weekly review, I'd like to just talk about Chapter 10, Assessment of the Head, Ears, Eyes, Nose, and Throat. Be sure that you are paying attention to everything that has to do with the routine techniques on page 144. You need to understand how to test those particular items as well as what it means. And you should also be paying attention to the blue and purple boxes in the chapter that have to do with risk factors and also have to do with health promotion. Okay, it's really important, especially in the elderly, that we understand some of the changes that occur as someone gets older, what's expected, what's not expected. So besides that, I'm not going to ask you anything about the posterior eye. That's an advanced skill as far as looking at the posterior part of the eye. But on page 150, when it talks about inspecting the pupils for size, shape, reaction to light, consensual reaction, and accommodation, be sure you understand what that means, because when we chart PERLA, that means that we've assessed for accommodation, and so you'll need to know exactly what that means and what we're testing for. Let's see, I'm not going to point out everything, but on page 156, I think it's important to understand the placement and angle of ears, especially in the pediatric patient, and what that might mean. So be sure you've looked at that. It's also important that we look at the common abnormals. Okay, so if you turn to page 164, you're going to be inspecting the mouth. You're going to inspecting the teeth and gums. You should know the differences between different cultures and ethnicities as far as what's the expected finding in the interior mouth. Many of the medications we give in the hospital will cause mouth problems, so you need to know what normal is, and you need to understand the types of things that can cause abnormal. So a lot of the antibiotics can cause something that looks like thrush. A lot of medications can also cause ulcerations inside the mouth, as well as people that are just NPO and not eating. Sometimes they'll have mouth issues as well. So you need to be familiar with what the normal mouth looks like and be familiar with some of the common abnormals. Starting on page 172, there are several pages that talk about common problems and conditions. And I think that's important as well, because many of these things we're either responsible for screening for. We need to have a good understanding of exactly what these limitations are, especially when we're talking about hearing impairment in the elderly, common eye problems in the elderly. So be sure you take a look at those. There's some great pictures on page 177, some of the common abnormals of the inside of the mouth. And be sure that you pay attention, again, to the risk factors for oral cancer and what kinds of lesions you may see and where they're most likely to be when you're assessing someone you notice a problem in their mouth. You're not going to be responsible for palpating the thyroid gland, but I do want you to understand what kind of symptoms a patient might complain of with thyroid disease. So be sure that you look at page 178. And of course, be familiar with the word goiter. It's probably on your vocab list. Okay, so I will see you all in class either on Tuesday or Wednesday. Be sure you bring your stethoscopes, because we're going to be doing a respiratory assessment. I've also fixed the links for the skills videos, so hopefully those are going to be working for you now. Let me know if you're still having problems with those, and I will see you in class this week.